everyone, and welcome back to Coffee Mug. I'm Elizeta, and I'm here with my beautiful co-host, Carlie Griffiths. How are you?
Hi, everyone. We hope you're okay and happy and smiling.
Yeah, and you're smiling because today we're back with another episode, and we're gonna discuss seizures. Why do we get seizures? What types are there? And how you can help someone having a seizure. Before we start discussing all this, we want to say that we are not medical professionals, and the knowledge that we are sharing is based on experience and research. The purpose of our podcast is to purely educate others and ourselves. Please talk with a medical professional or someone close to you for diagnosis and help. Now, after the disclaimer, I think we can start with the episode. So, what are seizures? Seizures are sudden electrical changes or disturbances in the brain, which can cause perceptible symptoms such as in behavior, movement, or feelings, but you might not even have symptoms at all. According to Healthline, the symptoms of a severe seizure include violent shaking and a loss of control. However, mild seizures can also be a sign of a significant medical problem, so recognizing them is important. And that's exactly why we're doing this episode today, just to bring awareness. So, most seizures last from 30 seconds to 2 minutes, but if it's longer than that, or in case you have many small seizures in 24 hours, it is a medical emergency and you should definitely seek help from a doctor. You might have epilepsy, so you might need to talk with someone. Again, we're not medical professionals, we're just mentioning according to the research that we've done and things that we know. Based on the research of Mayo Clinic, some symptoms of seizures can be dizziness, a change in vision, an out-of-body sensation, temporary confusion, a staring spell, uncontrollable jerking movements of the arms and legs, loss of consciousness or awareness, cognitive or emotional symptoms such as fear, anxiety, or déjà vu. These signs can range from mild to severe, and they vary depending on the type of seizure you might be having. As far as it concerns the reasons why we get seizures, it could be one of the following: alcohol or drug withdrawal, drug abuse, epilepsy, head injury, brain infection such as meningitis, an electrolyte imbalance, stroke, electrical shock, extreme high pressure, really high fever, poisoning, brain tumor, which is really rare. Let me just say that. Flashing lights, moving patterns, or other visual stimulants, liver or kidney failure, very low blood sugar, maybe Tourette syndrome. It's still, you might get some seizures from that, from what I read. And it could be from COVID. I really didn't want to mention that word, but here we are. But because you get really, really high fever sometimes, you might get seizures.
Yeah, I think it's important to note because it is quite a new thing. We are all living in it. But if you do get seizures triggered by COVID, then it is important to know that these things can happen.
Yeah. And now that we explain what seizures are, Carlie, would you like to tell us about the different types of seizures that exist?
Yeah, of course. So, based on our research, we can see that seizures are generally described in two major groups, which are generalized seizures and focal seizures. So, the differences are that they begin in different types of the brain, and they begin differently in those places in the brain. Focal onset seizures are where a person is awake and aware during a seizure. So the term focal is used instead of partial to be more accurate when talking about where the seizures begin. So it's literally just for medical professionals to communicate to each other to explain where in the brain these seizures are coming from. Focal onset impaired awareness is when a person is confused on their awareness and is infected in some way during a focal seizure. So that could be you're having a seizure and then you're like, where am I? Or I can't see. Or things are triggered by that. And this is called focal impaired awareness seizure and can be used or be called a complex partial seizure. Then the other type of seizure is an unknown onset seizure. So these begin, and the beginning of the seizure is really unknown. Mm-hmm. Nobody knows where this started, and which is why they're called unknown. A seizure could also be called unknown onset if it's not witnessed by another person, or the seizure is happening alone at night, where the person doesn't quite understand what is going on. As more information is learned, you realise that actually there is a lot to learn about the two different seizures and why they're completely different. And I feel that that's maybe something that people definitely need to look more into.
Yeah, definitely. Did you have like any situations that you experienced, like yourself a seizure, or had someone else have a seizure in your life?
So my little brother actually has epilepsy and he has absence seizures. So it means that his brain sort of, let's describe it as it sort of turns off. So it sort of just switches off. He's aware of his surroundings, but he can't communicate it and he just stays sort of. But then also when I was in school, this boy in the yard started shaking and then he fell to the ground and everyone started freaking out. The teachers had to bring pillows out and put a blanket over him, and it was really quite a scary situation.
Yeah.
But both of these things are something that, from a witness point of view, is really scary. Have you experienced anything in terms of seizures yourself or with others?
I have once. There was this guy at school. He was older than me, and literally we were out in the yard at school. It was high school, and he fell to the ground, and he had foam on his mouth. Like, is that a sign of epilepsy?
Yeah, it can. Yeah, it can cause convulsions.
Yeah. So he was there, and thank God one of the biology teachers was around there, and she knew what to do. So she literally stormed, she ran through the yard, and when she saw him, she felt like on the ground. She put his head on her lap, and she was waiting for the seizure to be over, and she didn't let anyone touch him or anything until the ambulance was there. He didn't get up. It was like he passed out afterwards. So the seizure ended, and then he was on the ground unconscious. Is that's possible?
No, that is the right term. Yeah.
And the ambulance came and got him, but I think he had epilepsy. Yeah, he had epilepsy. That's the only thing that I've experienced. But if something, knock on wood, I don't know, it's just it's a really stressful situation.
It really is.
I really don't know what to do. I literally panic a little bit.
100%, me too. And I think from learning and researching into this, we now know what to do when someone is having these type of seizures. So we're going to share this information with you guys. So it is really important to stay with this person until the seizure ends and they are fully awake. After it ends, help the person sit in a safe place. Once they are alert and able to communicate, tell them what has happened in very simple terms. Being clear with these people is so important because they might not know what was going on, and you need to help relay this to them. You need to comfort the person and speak calmly. There's nothing worse than freaking out, because if you're panicking, you're really going to scare them.
Yeah.
You need to check to see if the person is wearing a medical bracelet or other emergency information. So if they're wearing a medical bracelet, you're more likely to understand the situation. Some people who have epilepsy and other conditions wear bracelets to notify others if they do have a seizure. You need to keep yourself and other people calm. Other people around you, if they're freaking out, you need to look at them and be like, look, it'll be okay, we will sort this out. Taking it, being assertive and taking control of the situation is also very important. It's also really important to note that not all seizures require emergency medical attention.
Yeah, that's something that I wanted to ask you.
Yeah, 100%. So you do not need to call 999, 911. You do not have to do that every time. So we've checked the reasons why you need to. And they start with, the person has never had a seizure before. So this is the first time that it's happened. It's really important that you do alert medical professionals. The person has difficulty breathing or waking up after the seizure. This is really key. So this doesn't happen all the time. We're not saying this to scare anybody. We just want to show you what you can do if these sort of things happen.
Yeah, how you can help.
Yeah, 100%. So if a person is having difficulty breathing or waking up, that is another reason why you need to alert people. The seizure lasts longer than 5 minutes. As earlier we explained that it only lasts between 30 seconds and 2 minutes. The person has another seizure after the first one. So the seizure is either prolonged or they occur one after another. The person is hurt during the seizure happens in water, or the person has a health condition like diabetes, heart disease, and is pregnant. So obviously you're not going to know this information unless you've communicated effectively. So that's going back to the earlier point, it's so important to stay calm and communicate because you need to know clearly what is going on and what to relay to emergency services. we also wanted to quickly touch on what not to do
Yeah.
when a person is in a seizure, because you need to keep yourself safe and them safe. So please never do these. So do not hold the person down or try to stop them from moving. This will not only hurt you, because they might be trying to punch out, being scared, but this could also really injure them and also disturb the calming down of their seizure. So please, please, please be aware of this. Do not put anything in a person's mouth. This can injure their teeth and jaw. A person cannot swallow his or her tongue.
I literally wanted to ask that. You know.
Yeah, so we've actually, we're now Mythbusters.
Yeah.
Look at us go. They cannot swallow their tongue. So the last thing you need to do is put something in their mouth, because not only would they clamp down on it and injure themselves, but if you put their finger in their mouth, your finger in their mouth, then, I mean, yeah, we can all see where that's going.
No.
Also, please don't try and give the person mouth to mouth or CPR. People usually stop breathing again on their own after a seizure. It's not something that you have to think, oh my god, this person isn't going to stop breathing. You just have to ride the seizure out, see how long it lasts, and then work out what you need to do.
Yeah.
Do not try and give CPR.
Obviously.
And then lastly, do not offer the person food or water until she is fully alert. If this person is lying there and is not really conscious, do not stuff a burger down their throat or try to give them a cup of tea. That's the last thing that they need right now. We're saying this lightly. I'm not trying to be rude, but I know how easy if someone's ill, I'm just like, oh, would you like some food? Can I look after you?
Yeah.
But the last thing someone needs who's just had a seizure, who can't even wake up properly yet, is here's a burger. That's probably the last thing on their mind.
Oh my god, yeah. Would you like a burger? Would you like some food?
Here's some chips.
Yeah.
Dumb.
I mean, I get why, because as mentioned, like one of the reasons why you might be having a seizure is because you with your electrolytes, or maybe like you're dehydrated.
You might
as
even have
well.
diabetes, which might
Yeah.
require you to eat more sugar.
So I get why, but at the same time, don't do that. Don't do that. It was really, really interesting. Thank you so much for that, Carlie.
No, thank you so much. I feel like we both understand a little bit more about seizures now, and about what to do, what not to do, and what a seizure is. And I feel that it's so important to know these little things. I hope you guys have learned something with us.
Yeah, and I think what we can, apart from all the knowledge that we share, we can get out of this podcast is you need to be calm at all times. Just breathe and do what needs to be done.
I feel that being calm is going to be something that correlates throughout our series at the moment.
Definitely.
Because actually a lot of the things we're researching, which you can see previously in previous episodes and future episodes, being calm is so important.
Yeah.
Other people being calm when you're having these symptoms is so important. Not only does that mean that you'll freak out less because everyone around you is being supportive and nice, but it also means that if you're the person taking charge of the situation, you can see things more clearly.
Yeah, just be calm. Teach yourself how to be calm, and I think it will be something that will serve you your whole life.
I think that's definitely something that we're going to work on.
100%. Yeah.
Being calm, guys.
Yeah. Just keep it together. So thank you so much for listening to another podcast. We hope you enjoy this episode. Please don't forget to reach out, say hi, share your comments, your stories on our Instagram, Twitter page.
Yeah, we love you guys. We love hearing from you.
Yeah, our website. Now we have a YouTube channel again, so if you want to like, subscribe, or comment, or whatever you want to do.
Yeah, just come say hi.
Yeah, literally. And we love you. Take care. See you next week.
See you next week.